Hello dear doctors, dear colleagues, Nikita is again with you and welcome back to our guided surgery in the DEVIATIONS YouTube channel. In this video we are going to talk about how to check the accuracy of your surgical guide after the operation, after the surgery. We will take a closer look on the technique allowing to estimate the accuracy of the implant placement, and please do not forget to take a look at the comments below the video, take a look at the description of the video, because you may find something interesting there for you. Let's go. So firstly, we see the surgical guide here we have made and the surgery, which is actually will be made in the future. What do we have to do firstly? Firstly, we have to set up all the implants and choose all the multi-units here. That's the first thing. The second thing is that we have to segmentate the bone. You will understand the whole process of it. Just follow my steps and everything gonna be okay. So let's press segment mandible in order to perform the automatic segmentation of the mandible. Here, yeah, everything is good. We press finalize, and the main idea is that we press yes, okay, and the main idea is that we are going to boolean implant axis with our bone segmentation, and we will connect it with our control CBCT scan made after the operation, after the surgery. So now let's get to the sandbox, because the needed files are located in the sandbox section. So we press Boolean operations, and object A is mandible, offset is 0, operation merge 2, and now let's choose a file which is called merged abutment axis. We press apply, and now we have some funny model which is called Boolean1, and this model will be needed in the future for future performance. I will show you on the next steps as well. And also let's make another option is to we will combine anatomy scan and merged abutment axis as well. We press apply, and we have Boolean 2 as well. Okay, now let's end tool, let's press finalize, and now what we have? We have these two. Let me just turn off everything which is not needed right now. We have Boolean 1 here and Boolean 2 here. The main idea is that we will receive after the surgery the control CBCT scan with the implants installed, and we will actually upload these two files to new CBCT scan, and we will have a chance to estimate the accuracy of our guide. So let's keep it up, and I will show you how it's supposed to be done in the control CBCT scan. So here is the view of our post-operation CBCT scan. Now we have to adjust 3D settings. By the way, if you have such a picture on your 3D scene with soft tissues, with nose, with lips and so on, you just have to slightly change the volume options in order to visualize everything we need. Yeah, that's okay. Now let's construct the CPR plane just to have a chance to place the implants on 3D scene. You will understand everything just in a few seconds. We press next step, and since we have done and since we have a RealGUIDE project of the previous guide we made, we have the implant report of this patient, and also we have a chance to actually see the sizes of implants which were installed, which were inserted in the bone during the operation. So our goal is to set up the exact sizes and exact model of the implant we have planned to the existing CBCT scan. So here we see that 3.2 and 4.2 is 3.675 to 11.5. It's okay. Now let's place them. By the way, that was Noble Biocare. I don't really see the yellow color, but it has me right now, so we have to place the implants exact on the same position of the existing implants. I mean, on CBCT scan. Of course, it's approximate. Of course, it's not 100% accuracy and so on, but it will actually tell you about the direction of the implants, their position and so on. So let's press apply. Let's do the same thing with 3.2 as well. And of course, you see that the implants have, let's say, quite shadowed, because the real implants are on CBCT scans are actually quite wider, looks quite wider than their 3D models in RealGUIDE. Now let's just perform a bit of incline here. So everything is okay. Now let's double check everything with the axial view. It's okay. So this is gonna be 4.4. Let's return to our implant report. 4.4, 3.3 to 10, and the same size as well from another side. I would rather change the color of the implant, not to be just to make it clear, just to make it quite well seen on the 3D scene. And yeah, the most challenging part is to set up the needed incline. And so okay, we're almost done. The main probably drawback of this technique is that everything is related on your manual placement, but once again, this is just a way to understand whether it was successful or not. I mean, the whole surgery. So 3.6 is 4.3, and here is the same size of the implant. Now let's change color as well. We press apply. By the way, we see these two axes. These implants were supposed to be parallel, but anyway. And the last but not least is located here. Okay. And now we have to write a segmentation of the bone as well. let's go back to the bone segmentation. We press segment mandible, and now what we are going to receive is to receive the same model of segmentation. So let's just remove isolated components here. Let's remove them, finalize. The program is calculating all the files. We press yes, 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 okay, 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 and probably some of you could already guess what's going to be next. And we are going to import all of the scans. We have all of the scans, all of the data we were making in previous steps in the previous RealGUIDE project when we were actually making the surgical guide. So we have uploaded the data from the previous project, and now as probably you could guess, we will just compare the axes of the implants and so on. Now, firstly, since we have two tooth here, we will try to align this first scan to the to this existing tooth, because they were not removed during the surgery. And now let's match it to the STL files, STL to DICOM, matching STL and STL. We'll try to make an assisted. And since you have probably a lot of teeth saved in your jaw, this technique will be suitable, but we see here that the alignment is not properly done, and it's quite pointless to try to align it with two teeth. But my actually goal is to show you the technique that you can not just segmentate the mandible or maxilla, you can just use your scans if the teeth are saved on the jaw actually. So now let's make it a bit more accurate, but here is impossible to do it with two existing teeth. That's why we make X-ray guides for such purposes. Okay, now once again, let's pretend that there would be a lot of teeth on the jaw, and this technique would be actually workable. But therefore, in order to compare two files between each other without actually scans, therefore we have provided the double segmentation of mandible, because you see some parts of mandible which are actually alike and which were not actually changed during the operation. So let's press once again that data import. Let's press matching STL on STL, because we will match two STL files between together. So from file to mandible, now let's press by brush, and let's find the same areas of the mandible we have. Of course, they will be quite different comparing to each other, but anyway, at least we will try. Now let's press fit, and yeah, of course, there is some mistake in the error in the combining two segmentation of bones between all together. But anyway, there's just there's just one option of checking this result. So now, as you can see, the orange axis, now let me just change layout. So now, as you can see, orange axis is how it was planned. I mean, the axis of the implants, how they were planned and so on. And the green one and purple one is how they actually were installed. Just a few words about this surgery. This was done without any type of guided screwdriver. That's why actually you see some divergence of the axes, especially in distal areas. But anyway, the starting point of each implant is quite the same. That means that most probably the guide made it work quite well. I mean, the surgical guide was successful because the areas of the implant insertion is absolutely the same on all of the 6 implants, but the insertion of the implants itself without guided screwdriver actually brought about some mistakes of the positioning of the implants. But anyway, consider this surgery successful or not, it's absolutely up to you. I hope you will use this technique in order to estimate the accuracy of your implants, and I actually think it's quite useful technique to use during your daily work. So, dear colleagues, many thanks for watching. I hope now you will use this technique in order to estimate the accuracy of your implants, of your surgical guides. Nikita was with you. Please do not forget to subscribe to this channel, put your like to this video. It's very important for us. Please take care. Good luck with your job. Bye bye and see you in the next videos.